And now, it's my pleasure to introduce to you Dr. Amy Milor. Dr. Milor is an accomplished board-certified general neurologist trained in the diagnosis and treatment of the nervous system, including the brain, spinal cord, peripheral nerves, and muscles. Dr. Milor's goal is to treat each patient as she would want her loved ones to be treated. She believes that the best treatment for a patient may be the emotional and social support offered by the physician. Dr. Milor will be speaking on the topic of neurological effects of the brain. Please join me in welcoming Dr. Milor.
All right, thank you all for having me. Can everyone hear me okay? All right, excellent. Well, as stated, I'm a general neurologist here in the area. As a neurologist, I see several different types of diseases, things like dementia, Parkinson's, multiple sclerosis, migraines, epilepsy, so it's quite a diverse group of patients that I see. I really got my interest in neurology because of family history. My mom's dad had dementia, and interestingly at the time, they said it was Alzheimer's dementia. He later on was in a study when he passed, and they actually did an autopsy and determined that it was not Alzheimer's, some other non-specific form of dementia, but that really started my interest in neurology. Also, my dad's dad, who I did not get a chance to meet because he passed before I was ever born, was actually diagnosed with Parkinson's disease. And actually, he was one of the first patients treated with a medication called carbidopa-levodopa, which is still one of the most common medications or formulations of medicines that we use to treat Parkinson's today. So that really sparked my interest, and today we're going to be talking about a little bit how our nervous system changes as we age. And okay, good. If we want to go skip ahead to the slide that says neurology. I'm not sure who's doing slides here. Or do I do it with this one? Let's see here. Oh, no, we're going the wrong way, I think. There we go. Perfect. All right. So what exactly is neurology? Neurology is the study of the nervous system. So the nervous system is broken down into the central, peripheral, and autonomic nervous system. The central nervous system is made up of our brains and our spinal cord. The peripheral nervous system are the nerves and muscles that branch off. And then we also have the autonomic nervous system. That is basically a communication system to many of our organs, like our heart, our lungs, our bladder. So that controls things like blood pressure, heart rate, bowel and bladder function. Neurologic diseases account for about 50% of disability after the age of 65. So certainly a big impact on the medical system. Symptoms that are normal for aging can often be very similar to some of the early signs of neurologic disease. So it's really important for us to be able to differentiate as patients and as caregivers what is normal and what do we need to be more concerned about. So how does our nervous system change with age? Believe it or not, beginning about the age of 40, we actually start to have degeneration of the nervous system. Things like the central nervous system, we talked about the brain and the spinal cord, begin to atrophy. So the actual volume of tissue in those systems begins to degenerate, decline, the neurons die off. We also have hardening of the arteries. This is from things like cholesterol, high blood pressure, so buildup of hardening of the arteries, which leads to things like stroke. The peripheral nervous system also degenerates. I mentioned earlier those are the nerves that branch off, for example, to the hands, the feet, also the autonomic nerves. If you think of a nerve kind of like an electrical wire, and it's just no longer sending the signal as efficiently as it should, and that's what happens with normal aging. Our muscles also begin to atrophy or degenerate, so we have less strength and power, and this can affect symptoms as we age. There's also a decrease in hormone and neurotransmitter levels. And these are basically, you can think of them as chemicals that help our nervous system to communicate and to tell different organs or systems what to do. So these changes that I talked about, the atrophy, the decrease in neurotransmitters, what does that mean for us as far as what kind of symptoms we might have? With normal aging, we can definitely see some memory loss. The typical things that might be normal for age would be slower processing. We may just not be able to follow things as quickly. It may take us longer to understand or learn new things. We also might not have as good of an attention. We might need to really focus more on a task. And definitely we can see short-term or decreased recall. And we'll talk a little bit more about this later. Balance is another big symptom. It's normal as we age to not have as good of balance, and that's why falls are a big risk and a big impact on patients and, as I said, the medical system and disability that can occur. Imbalance, we talked about the different parts of the nervous system, and again, another area I'll talk more about, but many different parts of our nervous system affect the balance. We think about the cerebellum, or the back part of our brain. That's our balance center. As that degenerates, we're at a higher risk for falls. Also, we talked about the peripheral nerves. If we can't feel the floor or we can't see as good as we used to see, it can increase our fall risk. Weakness of the muscles. Certainly if we're not as strong, maybe going upstairs or stepping off a curb, we have a higher risk of falls. I also mentioned the autonomic nervous system earlier. The autonomic nervous system, as I said, affects our blood pressure, heart rate, and so patients can become lightheaded or dizzy, and this can increase fall risk. Also in the autonomic nervous system, it affects our ability to tolerate certain temperatures. So we may be more prone to things like dehydration or heat stroke. So of these different symptoms, I think the two that I get the most questions on, or even the most consults, if I get called to see a patient in the hospital about something, it's often memory loss, confusion, or falls. So I'm going to talk a little bit more about each of those areas. So as far as memory, we've all probably said, oh, that was just a senior moment, or I had a senior moment. So it can be very normal to maybe walk into a room and for the life of you can't remember what you came in there to get. Typically, it'll come to us later. It's also normal to potentially forget maybe the name of a character in a movie when you're telling a story about the movie. These can be normal aging symptoms. But some of these symptoms can also be very early signs of diseases like dementia. So it's very important to talk a little bit more about how we can try to differentiate. And before I get into some of those warning signs, I just want to talk a little bit more about exactly what is dementia. Dementia is actually a group of disorders. Let me get this. There we go. So dementia is a group of disorders. It's a common question that I get. What's the difference between dementia and Alzheimer's? Another statement that I'll often hear is, well, mom doesn't have Alzheimer's, she just has dementia. It's not that bad yet. So dementia is a group of diseases, and Alzheimer's is the most common form of dementia. So it's just one type. It's not the most severe. It's just one specific type. It does account for about 60 to 80% of dementia. Some of the other types of dementia are Parkinson's related, vascular, so there are other diseases in this group, but often patients think of Alzheimer's because it is the most common. And as I mentioned, some of the symptoms early on can be similar to maybe those senior moments, but there are some things that we can use to help differentiate what might be normal and what might be concerning. And I don't know if they've had a chance to pass out some handouts. This lecture was initially supposed to be prior, and I didn't have these in the original slides, so I made some handouts. But the next handout, or the next thing to look at, is the handout that says Making Sense of Memory Loss, if you have that. If you don't, I think they said they were going to leave them. Oh, you're coming around right now. Good. So she's getting to you. So Making Sense of Memory Loss. You'll see on the left-hand side symptoms of Alzheimer's, and on the right-hand side normal memory loss for aging. And I think the key with differentiating, when we read through this, you'll see some of the common themes is frequency and severity. So we mentioned those senior moments earlier. Something that may happen occasionally, something that's not severe enough to impact your daily function, is more likely to be normal for age. Do you want me to give you a minute to get them? I don't know if you guys are okay. You're all right? All right. So first one is a symptom of Alzheimer's, forgetting whole experiences. So certainly if a day goes by and you've been to the zoo with the family, and maybe a few days or a few weeks later you're talking about it, and you can't remember that you even went to the zoo. That's going to be concerning. If you went to the zoo and you saw the cheetah, and you just don't remember seeing the cheetah, but you remember all the other parts of the experience, that might just be a little normal age-related memory lapse. The next one, rarely able to remember later versus often able to remember later. So with Alzheimer's, I mentioned earlier the senior moment. You walk into a room, you realize you forgot something, and maybe an hour or two later, you remember what you were going in there to get, and you go back and get it. That would be normal for age. What would be more concerning is maybe it was that you went into the room to take the roast out of the oven, and 2 days later, you don't realize and it's still in there. So you never remembered that you even had a roast in the oven. Those are going to be more concerning. The next one, gradually unable to follow directions, either written or spoken versus usually. And so again, here the theme is really frequency and severity. So we talked earlier about attention and focus. Some of those things can decline with age. And if you're getting multiple directions and maybe multiple things are going on, you might have a little bit of difficulty following and maybe need somebody to repeat directions. And if that's on occasion, probably a normal age-related lapse. But certainly if it's frequent, if it's impacting your ability to function, then that's more concerning. The next one is gradually unable to use notes as reminders versus usually. So certainly with Alzheimer's, if you're writing things down on your calendar, if you're making a list of your meds, trying to keep track, and you're still failing at it despite those reminders, that's going to be more concerning than if you use your reminders, you're able to keep up with it. So with normal memory loss, we often do have to use lists and reminders to help us keep things organized. But if you're able to keep up with those activities of daily living, that's typically more normal for age. And then the last one, gradually unable to care for oneself versus usually usually able to care for oneself. So I mentioned earlier when we talked about what is dementia, it's a progressive disease that affects our ability to do these activities of daily living, driving, finances, self-cares, remembering to brush our teeth, to shower, remembering that these things are important, making meals. If those things are being impacted, that's certainly a clear concern versus just normal memory loss. So at the end of the day, I think the key is, I said, frequency and severity. So if you're seeing that these memory lapses are becoming more common, more severe, and they're impacting your ability to function, you're frequently missing appointments, you're forgetting to take your pills, those are definitely warning signs to be concerned about. There is one other handout I had put, which is the 10 warning signs of Alzheimer's or dementia. It's really geared more towards Alzheimer's. This came from the Alzheimer's website. I'm not going to go through step by step, but I know people like this list. It just gives some insight into some of the things that might be concerning. So I think really the important thing here is it's never too early, if you're concerned, to get it checked out. It's good to know some of these warning signs. It's good to know what might be normal versus what's concerning. But at the end of the day, if you're not sure, you talk to your doctor about it, you get early screening, you set a baseline so that we can monitor to determine if there is something more concerning. The other thing that's important is ruling out things that might mimic dementia or normal memory loss for age. Other medical problems like vitamin deficiencies or thyroid problems. So just important to remember it's never too early if you're concerned. A lot of times I'll have patients that'll come in and they'll maybe say, my daughter made me come, I think it's just going to be a waste of your time. It's never a waste of my time. Hopefully, I hope more often than not, I can tell a patient, everything's fine, let's not worry. But certainly, key is if you're worried, it's worth talking to your doctor about it. And then before I go on to the next topic, just wanted to add in a little bit, which again, I don't have a slide on this one, but add in a little bit about what we can do to prevent memory loss. It's definitely a common question that I get from patients. Is there a pill I can take? Is there a vitamin I can take? What can I do to try to battle what's normal for age or maybe to prevent something like dementia? Unfortunately, we don't have anything that's a guarantee. I don't have a pill I can give patients or a vitamin I can tell you to take that's a guarantee that you're not going to suffer some form of memory loss. But we do know there are things that can help. Physical exercise and mental exercise are probably the two biggest keys. And we know that these do help battle the normal aging process. So at least 30 minutes of aerobic activity 3 times a week is important to prevent memory loss and to try to slow any progression. And also, mental activity. So when we retire and we stop using our brains, we're more liable to lose them. So it's important to challenge the brain, whether it's games, puzzles, reading. If you look at the literature, a lot of studies will recommend learning something new, like a new language or a new hobby. So those are some of the things that we can do to stimulate and challenge the brain. I get a lot of questions about diet. Certainly a healthy diet overall. What's healthy for your heart is healthy for your head. So a diet that's high in fruits, vegetables, things like fish that have high omega-3s, those are all helpful for memory. Sleep is also another important area. On average, and the studies vary, but on average about at least 7 to 8 hours of sleep is recommended for good brain health. All right. So next I want to talk a little bit about falls. And you'll see some statistics here. 1 in 3 people over the age of 65 fall each year. And 1 in 5 of those falls will result in serious injury. So that can certainly be a big impact. And we talked earlier, just as a reminder, about some of the things that can cause falls. Things like decreased coordination from the degeneration in the brain, also loss of strength and sensation. And I talked earlier about peripheral nerves, muscle strength. So one of the examples of kind of normal age-related balance problems may be, you may notice that if you're in the shower and you close your eyes, you may get a little bit wobbly. And sometimes that can be because of the sensation in the feet. If we can't feel where our feet are on the ground and we close our eyes, we really lose any cue as to where our body is in space. And so that sensory loss from the peripheral nerves can affect the balance. Also, vision and hearing have a big impact on our balance, and we know that there are many different diseases and things that are more likely with age that can affect vision, hearing, so those things can all play a role in falls. Another area I wanted to mention was medication side effects. Definitely as we age, we tend to be on more and more medications. So it's important to continually maybe remind or discuss with your doctors, hey, are all these needed? Is there anything we could get rid of? Are we sure there's no interactions? It's also important to look for side effects. One of the most common side effects with medications is lightheadedness, dizziness, unsteadiness. And so it's important to, if you're starting a new medication, keep an eye out for side effects and make sure you're letting your physicians know if you have any concerns. So next I just wanted to talk a little bit about how we can differentiate, again, what's normal from what could be concerning for a neurologic disease when it comes to falls. So I mentioned earlier, falls are a common reason that I get consulted either in my office or I may get called to see a patient in the hospital after a fall. So when I go in to see these patients, right off the bat I have a number of different diseases in my head that I'm thinking I need to rule out. So I'm going to be screening patients for some of these symptoms. So really with this list, these are some of the common diseases that I may think of when I'm going to go assess a patient who's had a fall. And I just wanted to go through them and kind of give you some of the things that can help me and potentially help you to differentiate if you should be concerned or not. So one is Parkinson's disease. Parkinson's disease patients are definitely at a higher risk for falls. But it's different from the normal aging process because there are other associated symptoms. Patients with Parkinson's often also have things like tremors where they shake, also a stiffness or rigidity in their movements, and also a slowness in the movements. So those different symptoms can kind of be some of the warning signs that this is not just normal age. There's also a condition called normal pressure hydrocephalus, which is a form of dementia where we get too much water in the ventricles of our brain. With this condition, it can also kind of look like Parkinson's, and patients may also have memory loss and urinary incontinence. So those are some symptoms that aren't necessarily normal for age if they're frequent and severe enough. And they could be some of the warning signs that there may be something else going on. Another very common is neuropathy and myopathy. Neuropathy is a nerve disease, myopathy a muscle disease. Most people, when they hear neuropathy, they think of diabetics. You don't have to have diabetes to have neuropathy. So it's important to kind of know what are some of the other signs and symptoms of neuropathy. Neuropathy can not only affect the balance, but you can have burning. The feet can feel numb or tingly. So it's not just a normal, I'm a little unsteady. There's typically some other associated symptom there. Orthostatic hypotension. As we get older, it's not unusual to get up from a seat and maybe get a little lightheaded or dizzy. You got up too fast, or maybe first thing in the morning. And that can be normal with age. But if it's severe enough that you're falling to the ground, if it's severe enough that you're actually losing consciousness or passing out, and if it's frequent, then that's something to be concerned about and is typically a sign of some other underlying problem. And then the last one, stroke. So strokes certainly can cause falls. Patients will often present with vertigo, unsteadiness, dizziness, weakness that may lead to a fall. But stroke certainly is a little bit easier to differentiate. The aging process is going to be subtle. Stroke is something that's very acute and sudden in onset, which differentiates it from just the aging process. So then the last handout that I have is a little bit about fall prevention. Certainly in talking about falls, there are some things that we can be doing to try to minimize our risk of falls, whether they're because of normal age-related or pathological diseases. The first is staying active, so definitely exercise. Even if you feel like you're not making ground, it can help you to not lose ground. So a lot of times my patients will say, I tried physical therapy, it just didn't help, or it helped for a few weeks while I did it, but as soon as I stopped doing it, I lost the benefit. But that's because you've stopped doing the exercise and the activity. So if you continue with the exercises that are given to you or have some sort of regular exercise routine, that will certainly help to battle some of the normal age-related changes and minimize falls. Keep your home safe. So definitely a key one, and certainly if I see a patient that's having a lot of falls, we'll often have some of our home health companies go out into the home or educate patients about things that may increase their risk of falls. Clutter in the home, animals that may be tripping over or pulling you when you're trying to walk them, maybe certain shoes. This is probably one of my favorite when I get a consult for a fall and I have, maybe my 95-year-old lady coming in with these high heels like this, and I'm thinking, this is not the best shoes for her to be wearing. So we have to be a little bit more realistic about, what we can wear. And I think it talks on here about socks that are non-slip, wearing shoes around the home to try to help prevent the falls. Another thing that I don't think they really list on here is maybe the whole vanity thing. Like I said, with the shoes, I know, you want to look nice and wear the shoes, but a lot of times patients will come in for falls and they'll say, well, usually I use a walker, but I don't have it with me today. And, that's probably a lot of times why the fall has occurred. They're not real. They have a cane, they have a walker, but they're not using it. So we got to leave vanity behind and use our assisted devices if we need them to try to prevent falls. And then we talked a little bit about this before, but talking with your doctor about medications, about other things we can do to limit the risk if we do fall, like bone health, and then regular eye exams to help minimize the risk of falls. All right, so in summary, I'm hoping that some of the information I gave you today will help you to maybe have a little bit of insight into what are some of the warning signs or things that should be concerning that would make you want to speak with your doctor. Just learning a little bit about what could be normal for age versus what's more significant. And definitely, I think the key really is the frequency and severity. So again, whether it's memory or falls, something that's occasional, something that's not impacting your ability to function day to day is more likely normal, but something that is progressing, something that's becoming more frequent is something that you definitely need to be concerned about and speak to your physician about. And the fact that it's just never too early to talk to your physician, again, it's never a waste of time to touch base. If you have a concern, hopefully we get to tell you there is nothing to worry about and we'll see you in a year. And then finally, what can we do to battle the aging process? And again, it comes down to if you don't use it, you're going to lose it. So making sure you're staying both physically and mentally active, and both are absolutely key. You need to be doing both the physical exercise and some sort of mental exercise regularly to keep you going. All right? So hopefully that was helpful for everyone. I think because of the setup, they said we're going to do kind of a one-on-one question and answer, so I'll be available where I guess the one-on-one consultation is available. If anybody has any questions for me about what we talked about or anything else, I'm happy to answer those. Thank you, guys.